Hey everybody, it's Dr. Osgood here with Grassroots Functional Medicine. I appreciate you joining me here today to talk about a topic that I am very passionate about, and that is cardiovascular disease. I just wanted to start off by telling you a little bit about my history and why it means so much to me. So I actually started out in my career in healthcare as a paramedic. And one of the things you do as a paramedic is you're frequently responding to calls that are based on heart health. You know, a lot of emergencies out there are related to people having strokes or having heart attacks or hypertension crises. So I became very passionate and interested in cardiovascular disease very early on in the career. And unfortunately, you know, was also witness to a lot of the devastation that families are left with after losing people related to heart disease. You know, cardiovascular disease is the silent killer, and they call it the silent killer because it is exactly that. You know, people can be perfectly fine one day and then drop dead of a heart attack the next day, and you don't always know it's coming, and it can happen to people from all ages. So, and unfortunately, we're starting to see the heart disease affect younger and younger generations, which is pretty scary. So one of the things with heart disease too is that, you know, a lot of these problems, a lot of these conditions, a lot of these, risk factors can be avoided. Unfortunately, we just, again, kind of put it off until there's an actual problem there. There's not a lot of prevention that goes into it. So I'm hoping today's talk just helps raise awareness of some of the tests that you can ask your doctor to perform to get an overall assessment of where you are in your risk for cardiovascular disease. Because you can really get a better assessment and get a better understanding of your risk by some simple blood tests or some simple imaging, and something you definitely want to be cognizant of, especially if you have a strong family history. For me, myself, I'm very blessed in the sense that, you know, my family is very healthy overall. We don't have a lot of cancers. We don't have a lot of autoimmune conditions, but the one thing that gets most people in my family, like many others, is heart disease. So, that's another reason that I'm very passionate about the subject and passionate about getting the word out so you can reduce your risk and prevent the fate that a lot of people are unfortunately affected by. So I wanted to, again, give you some quick statistics on cardiovascular disease. Number one, 1 in 3 people in the United States die of either a stroke or a heart attack. So, again, very, very high numbers here. And most of this can be prevented. This is from the AHA. As you can see here, 99% of Americans need to improve their heart health. 72% don't consider themselves at risk, when that's absolutely not the case for the majority of people. And 58% put no effort into their heart disease. And even in the clinic, we get a lot of people who come in for specific complaints and specific problems, but they are not really concerned about heart disease. And even if you're dealing with autoimmunity, or you're dealing with dementia or Alzheimer's or diabetes, what you really need to be thinking about is cardiovascular disease, because all of those inflammatory processes are what contribute to heart disease. And ultimately, that's usually what gets people into big trouble in the long run. So very important topic. And like I said, today I want to talk about what you can do about it to help identify where your risk is actually at. So I wanted to talk about, where people get into trouble with heart disease. So as you can see by this image here, this is a blood vessel. So what happens when people have heart attacks, the blood vessels, the arteries that supply blood flow to your heart become damaged and become problematic or occluded, or they rupture to where the muscle of the heart no longer gets any fuel, so it dies. And that's what happens with a heart attack. And when your muscle is not getting fuel, you run into arrhythmias and you lose blood flow to your brain, and then you ultimately die if it's not intervened upon quickly. When I look at heart disease, a lot of people, who are familiar with autoimmunity and familiar with thyroid dysfunction, familiar with gut health, are familiar with the concept of leaky gut. So I like to think of cardiovascular disease in the same sense, because essentially the same thing is happening inside your vessels. When people have leaky vessels, or these endothelial cells, which are it's the endothelial cells, are the inner lining of the vessel. That's what the blood actually contacts. When those become damaged from various stressors, whether that's toxins or high blood pressure or inflammation or hormone imbalances, whatever, or autoimmunity, whatever the case may be, those cells, are again not tight together. They become leaky, and then small particles will sneak through. They will accumulate. They will recruit more of their inflammatory friends, and then, as you can see in this picture, what it does is it builds up plaque, and that plaque puts pressure on that artery wall, which reduces blood flow, and eventually what happens is this can rupture, clot off completely, and again reduce blood flow to the heart muscle, depending on what arteries are occluded. And it can happen in multiple arteries. So that's just a little bit of a background of what we're looking at with heart disease, so you can understand why we're doing some of these tests. When we're looking at tests, there's a few categories that you want to consider. One is glycation, which is the byproduct of oxidated sugar, or having too much sugar. Sugar is very inflammatory. It's very sharp and jagged. Glycation is the process of proteins and nucleic acids and different components in your body becoming jagged and rigid and highly inflammatory. So when these things are circulating against that nice smooth blood vessel lumen, it creates damage and contributes to that leaky vessel that we see with cardiovascular disease. Inflammation, very important to evaluate and consider. That is a significant risk factor for heart disease, and happens for various reasons, which we'll talk about. And then oxidization, which is another really problematic thing that you can evaluate very simply with some labs. But oxidization is like, again, having rusted, jagged particles floating around in your blood vessels, bouncing on the walls, creating damage, recruiting, causing inflammation, and again, plaque buildup and dysfunction. And then immune dysfunction is another big player with cardiovascular disease that often gets overlooked. So we have to be focusing in on these areas and then some to really evaluate that total cardiovascular risk, because you can't look at one lab, you can't look at one test and say you're out of the woods for heart disease. It's looking at a variety of different factors. And when we do testing in the clinic, we are looking at all of these things and evaluating that risk based on all of the information, as opposed to just one or two specific labs. So one of the first things that we can look at very simply that a lot of people do with their primary or conventional doctors is looking at metabolic testing. So hemoglobin A1C, this is really a big one that is looking at your average blood sugar over the last 90 to 120 days. And when this is elevated, that is that reflects that your blood sugar is elevated. And as I mentioned before, blood sugar is very inflammatory, or increased sugar is very inflammatory. A lot of times this comes from diet, but your blood sugar can also be elevated because of inflammation and because of stress. I see a lot of patients with elevated blood sugar who are eating like rabbits. They're eating very clean, low in sugar, but their stress levels and their cortisol function, and they're always in that sympathetic fight or flight response, and that's causing their body to dump sugar at amounts that are too high. So it's not just about what you eat, although that does play a big role. When we see elevated blood sugar, that is a marker that suggests elevated elevated inflammatory particles related to the high blood sugar. Advanced glycated end products is the word I was looking for. And that's just a fancy word of saying that glycation, like I mentioned before, is happening, and that can cause nucleic acid or even cholesterol particles to be inflammatory and contribute again to that endothelial dysfunction. Insulin is very inflammatory too. So when we look at your fasting insulin levels, we want to see those low. I like to shoot between 3 and 6 on those numbers. And a lot of people are floating around with the 15, 20 range, and nobody's saying anything about it. But that is not good. good. That's very inflammatory. And with your blood sugar, with your A1C, your average blood sugar, we want to shoot for 5 on that. Prediabetes is greater than is 5.7 or to 6.4. 6.5 is considered diabetes. But we know even right before prediabetes, there's still inflammation going on there. So you got to be careful. And then we want to look at that fasting glucose as well, and that should be ideally right in the low 80s. Another really important marker is looking at the omega-3 index. This is looking for where you're at on your omega-3s. Remember, there's different types of fat, and there's inflammatory fats and there's anti-inflammatory fats. Omega-3 is one of those anti-inflammatory fats, and you get them from eating a lot of fatty fish typically. The smash fish is what I tell people to focus in on: salmon, mackerel, anchovies, sardines, and herring. Those are higher in those omega-3s. And when you're eating a lot of other, plant-based or inflammatory animal fats, then you can run into problems with higher arachidonic acid. And that, again, it works against you from an inflammation standpoint. So we can check your omega-3 index in your blood work and see where your risk factor's at. And a lot of people do need supplementation with omega-3s if you're not getting enough from your food. So omega-3s, very important. Focus on those fatty fish, and make sure you are supplementing appropriately with your omega-3 fish oils. I had somebody in the other day who was taking 3, capsules of fish oil a day, and her omega index was still super low. So we have to be checking these things. So you're not just taking supplements. It's not about what you take, it's what you digest and absorb. So we want to really pay attention to that. High sensitivity CRP, this is another quick and easy marker that you can get, but very important, because high CRP means that you have systemic inflammation. And we know that CRP does correlate with an elevated risk for cardiovascular disease. So if your CRP is elevated, we have to be focusing in on why it's elevated. What is triggering inflammation in your body? Ideally, you want to be less than 1. If you're greater than 1, that poses a risk. So we want to be working, moving, sleeping, eating the right foods, and battling any chronic infections, focusing on gut health to get this CRP down. And it's pretty awesome to see this go down. And a lot of times, people can feel it. They feel less inflammation. They lose that visceral fat. They improve their muscle function. So again, most doctors are looking at this, but make sure it's a high sensitivity CRP and really focusing on making sure your numbers are less than 1. That's really important. Homocysteine is another important marker for evaluating cardiovascular risk. This is a marker of methylation. So you want to be fasting when you do this. Ideally, you want to be the levels to be less than 8. But when this is elevated, sometimes there's a genetic component to this. A lot of you may have heard of MTHFR, or methyl tetrahydrofolate reductase enzyme, which is a genetic problem, or a SNP, that creates issues with breaking down B vitamins into their active form. So if you just take regular folic acid or regular B12, a lot of times that's not sufficient. We have to get you on activated nutrients, but that can substantially drop these levels. I see it numbers go from 15 to 20 down to 8 all the time, just by adding in the proper supplementation. And that significantly reduces risk factors for not only cardiovascular disease, but also, clots and cognitive dysfunction, strokes, and it helps with energy because your cells are getting the nutrition that they need to thrive. Standard lipid panel. This is again, this is what most people do. This is what most people get assessed, and it's not that it's not important. It is an important thing to evaluate, but it's just not as detailed as some of the other tests that I will mention here in a minute. But it is important to get this done and to look at your numbers. Again, I know everybody puts a lot of emphasis on the LDL, the total LDL, which is important, but there's much more to that story, which we'll talk about here in a second. Total cholesterol is LDL cholesterol. The more problematic tends to be the more problematic particles, plus the HDL, which are the beneficial particles, plus about 20% of your triglycerides, which is 3 sugars. And a lot of times triglycerides are up not from healthy fats, but from carbohydrates in excess of sugar, because it's like stored energy. If you're eating a bunch of carbs, a bunch of sugar, your body stores it as fat in the liver, and that's where triglycerides come from. So a lot of people think they're eating too much fat when their triglycerides are up, but the majority of the time it's actually related to carbohydrates and sugar. But triglycerides and HDL are the 2 big ones you really want to focus in on, because you want your good cholesterol to be up and you want your fat storage particles, your triglycerides, to be down. But having a total cholesterol, a lot of people, will throw statins out there for total cholesterol when they're not really evaluating each individual particle. And as we know, statins and some of these other cholesterol lowering medications can get you into a lot of trouble in the long run with other complications. Advanced lipid testing is what I wish more people would do, because I think this is where the money is at. This is where you really can break down your cholesterol and figure out, do you have the bad cholesterol, which are those tiny particles that can sneak in between that endothelial lining that I mentioned before. Remember that leaky vessel where you've got all of those individual cells that should be nice and tight together? Well, when those become leaky, then smaller particles will accumulate in there, whereas the bigger particles will just float on by. So we want to have lots of big, fluffy cholesterol particles and a smaller amount of those tiny particles that can get you into trouble with plaque accumulation and eventually leading to rupture. So we're looking at a standard panel. We look at LDL, which is total LDL particles. We look at total HDL, but there is actually, different LDL and HDL particles, which we do want to pay attention to. One of the things that we can use to assess how many actually bad particles you have and how many good particles you have is this apoprotein B and apoprotein A1. Apoprotein B is usually a good indicator of where your bad particles are actually at. So this is something that I test for frequently in the clinic to see, okay, your LDL is up a little bit, but how many of them are actually the bad LDL particles? This gives us a good understanding. And a higher level of ApoB is associated more so with increased risk for cardiovascular disease, whereas a higher level of ApoA1 is associated with higher good amount of good cholesterol. So we want to have more of these A1 particles floating around, or proteins floating around, because these are attached to those HDL particles, which indicate that you are better off and at a reduced risk. So again, getting that total cholesterol and the triglycerides and the HDL and LDL total is not nearly as good as getting some of these an assessment of some of these smaller particles. Now, small dense LDL particles are another important protein that you can assess to see if those particles you have are those small problematic ones. A lot of times with the small dense LDL, this is related to elevated triglycerides, which again relates to sugars and carbohydrates, but they're small. They sneak into those lumens, so they cause plaque buildup. So ideally, we want to have this less than 35, but making some dietary changes and optimizing the carb-sugar balance can really reduce this very quickly and reduce your risk as well. Lipoprotein A, this is one that's a little bit trickier. Unfortunately, there's a strong genetic component to this. So, this is a problematic lipoprotein. This is one that is very inflammatory and has been shown to be associated with increased risk of cardiovascular disease. We haven't really seen a whole lot of things you can do about this one. Sometimes optimizing hormone balance with testosterone and estrogen can help lower this a little bit. There's some research out showing that, but there's not a specific herb or a specific drug that I'm aware of that helps really reduce this yet. I know they're working on it, but again, when we're looking at overall cardiovascular risk, it's not one particle. What we're trying to do is lower as much the risk for all of these particles as much as you can. So if you do have a genetic predisposition, it's not going to take you down. Whereas if you have multiple factors that are problematic or inflammatory, you're going to have a higher risk of having issues. Oxidized LDL. So again, this gets back to that concept of oxidization that I mentioned before. And this is an easy marker to look at. There's a lot of good research with oxidized LDL. So remember, as I mentioned before, oxidization is like having rusted, jagged particles, roaming around your bloodstream, bouncing on the walls, tearing them up, and leading to inflammation. And that happens when your cholesterol, LDL lipoproteins, get oxidized, and that can be due to various dietary and lifestyle, reasons. So, oxidized LDL is something we definitely want to focus in on. Most lab companies can draw this, and focusing on not only reducing inflammation but also improving antioxidant activity, which will take care of some of these oxidized LDL particles. So easy test, very good test, a lot of good research with oxidized LDL. So this is another one I would encourage you to ask your doctor about, because it is a big player. Myeloperoxidase is another good marker for oxidization. So again, an inflammation. And when this is elevated, it tells us about the health of the lumen in that blood vessel. So if you have high levels, again, it's going to lead to more inflammation, more plaque buildup, and increase your risk for ruptures. So another very easy test to help you assess that risk factor. And you want to, again, be focusing in on antioxidants and reducing inflammation. LPPLA2 is a very interesting marker, and this is actually a good marker to look at risk for plaque rupture. So if we look back at the initial pictures I showed to you, when you're looking at that intestinal lumen clamping down and being pushed together by all of that plaque, those walls become very weak. And eventually, as the plaque accumulates, those walls will rupture. And when that rupture occurs, that's what happens is it ruptures, and the body, it's a natural defense, is to kind of clot off that damage. But unfortunately, when that happens, that's when you get occlusion of those coronary arteries, which leads to a heart attack. So this LPPLA2 gives us an idea of, what is your risk for plaque rupture, which is helpful in indicating a risk for a stroke or a heart attack. So another really good marker just to give you a good understanding of what's happening inside of those vessels. And then we've got the pro-BNP, and this is another good marker. It's a little bit different than some of those other cardiovascular markers that we've been assessing. This is actually looking at how much stress is the heart muscle under. So if you have chronic high blood pressure, or if you've got problems with cardiomyopathy where the heart muscle enlarges and your heart cannot pump or cannot squeeze as efficiently, or it's pushing against a lot of back pressure, the heart muscle becomes weak. And what happens when it becomes weak is those cells become stressed, and we will see an elevation of pro-BNP, which indicates an increased risk for heart failure. So again, another really good indicator to look at your overall health. And remember, when we're dealing with heart disease, there is a problem. You can have a problem with mechanical function, you can have a problem with blood flow, and you can have a problem with the electrical system, which is where the EKGs come in to see how that electrical conduction is occurring. And all of them are important at evaluating your total risk. And then finally, I wanted to talk to you a little bit about the CT coronary calcium score. This is such an easy test. I wish more people would do this and more docs would order it, because it's literally, what they do is a CAT scan. So there's always risk with CAT scans, right? There is a little bit of radiation from CAT scans, but you always want to look at the risk benefit. So when you're going on a statin or your doctor's prescribing something for your cholesterol, this is a great test to see, do you have a lot of calcium buildup around those coronary arteries. So as you can see in this picture here, in this example, we're seeing a calcium score of 0, which means the calcium level is very low and that artery is wide open. Over here, we're looking at, in the middle, you're looking at 1 to 300, which means there is some buildup. There is some calcification there, which will obstruct blood flow to some extent. That puts you at that intermediate risk category. And then this high risk category is greater than 300, which means you have some significant plaque buildup there, which puts you at a much higher risk. This is a test. I mean, in Austin specifically, we had some places lined up there where you could literally get this done for like $75 out of pocket. Insurance should cover this depending on what diagnosis codes you have or you qualify for. But even out of pocket, if this is a couple $100, it really is worth it, especially if you're looking at going on medications, for cholesterol or for cardiovascular disease. So, again, there's a lot. What I'm trying to emphasize here is the fact that cardiovascular disease is running rampant in our community. It's the #1 killer. A lot of people don't give it the attention that it deserves until it's too late. And a lot of times that's when, something serious happens. There's a heart attack, there's a stroke, or God forbid somebody actually dies. And that is, you're not out of the woods on this if you don't have a family history. You're not out of the woods on this if you're 30 years old. We need to be assessing our risks on multiple levels because, to see truly where you fall in that category of heart disease. And, no one's immune from it. Like it said before in that initial statistic from the AHA, 99% of people need to work on their reducing their cardiovascular risk. And that is not a medication. You know, there's no meds out there that are going to free you from this risk. You know, most people who have heart attacks have a normal standard cholesterol panel, and most people are on drugs to address cholesterol levels. But really, you have to look at the big picture. You got to look at the glycation, the oxidization. You got to look at the your individual proteins. You got to look at inflammation, and you got to look at your immune function. You got to take all of that information, put it together, and really figure out where your risk is at, and then always be working preventatively to keep it down, because that's what gets the majority of Americans in trouble. And there's so many things that we can do, not only to assess it, but also to reverse it. So I hope you found this information helpful. I really wish you the best of luck in your health journey. If you need anything, don't hesitate to reach out. We have a free guide on our website. We just made that up to help you understand all of these labs that we put together, labs that this guide you can print off and bring to your doctor and say, hey, can you get some of these tests done? Can we look at some of these tests to really evaluate my risk? And I would encourage you to do that, because more people need to be getting a more comprehensive, thorough evaluation, because so many people are dying from this silent killer. But again, Dr. Osgood with Grassroots Functional Medicine. If you need help on your journey to optimal wellness, visit our website, grassrootsfunctionalmedicine.com. Set up a free 10-minute consult if you feel like you may be a good fit, and we'll just I'll talk to you about where you're at, what your goals are, and if you'd be a good fit for our program. So I hope you guys have a blessed day, and look forward to seeing you in the near future. Thanks.